an extended question and answer session. And any questions that they might not be able to get to during the call, they'll follow up with email responses. So additionally, a reference document was sent out with a PDF version of today's presentation, and that document has some hot links to information being discussed today. So today we're going to hear about global health technology equity, how emerging clinical engineer healthcare technology management leaders can help. And our presenters for today are Mr. Antonio Hernandez and Mr. Tom Judd. Both of these individuals have over 40 years of experience in the healthcare technology management field. And you can see the specifics of their backgrounds and accomplishments in their bios, but I know that they're both very eager to get started, so I'll go ahead and turn things over to them now.
Thanks so much, Jennifer. I assume everybody can hear me okay. This is Tom. Can I get a little feedback? Thanks.
I can hear you, Tom.
Very good, thank you. And this is a time of year, of course, that's an important time of year for thankfulness. And I'm going to have a little litany of thanks here. Thankful for you folks that are here today from around the U.S. and around the world. And if you are not able to join us, and listen later to this recording. I've had the privilege of knowing Antonio Hernandez for about 25 years, so we look forward to hearing from him in a moment. I'm very thankful to ACCE for giving us this chance, and we want to focus on a young audience today, and Antonio and I are young in our own minds, maybe as many of you are, but we want to focus on the millennials and the emerging leaders, but all of us have a stake in that wherever we are in the age spectrum. And we want to share our passion and invite you to come along with us on this global journey. And I know many on the line have really been on the global journey with us for a long time. I saw Michael Ching and others. Thanks also to Kaiser Permanente Clinical Technology that is allowing folks to pipe in from all around the world through that channel. And, of course, Jennifer DeFrancesco working with VA and bringing in those folks. So with that said, we're going to get started. Next slide. And Antonio, why don't you say a word?
Oh, yes. First, thank you for all of you attending this workshop. Definitely what we want to achieve today is to pass a strong message, especially to the new generation. The scenario in health is evolving and fast changing. Also, the way that healthcare is provided. And we, clinical engineers and health technology managers, we need to align our knowledge with these changes, and in some parts we are leading the change, so we have more responsibility. Tom.
Well, so here we are, slide 3. Why are you here today? And we're going to address that first. Important question. Hey, and then we're going to set the stage around the global health and global health technology equity. You won't be surprised to see that to talk about that, we're going to talk about health technology management global status. We're going to talk about clinical engineering and IT and that big connecting concept of e-health, and close with what emerging leaders can do, what we want you young folks to be doing. And so there are some references, and there was one last link that the reference was sent out. So next slide. Okay, so why did you come? Among participants today, what's your attraction? And of course, we can think what's the intellectual curiosity about what's going on around the world with health technology equity and global health. There's the you're already involved or you're interested in becoming involved. And sort of maybe you could say, what's going on with your head, what's going on with your heart? No matter which one is engaged here, we're glad you're here. Briefly, Antonio and I want to talk about what we've seen happen over the last 40 years and lay out how you can contribute for the next 40. So a word about that. I was in the field as a clinical engineer for 5 or 10 years. I was in my 30s and was sent by my hospital in Paraguay as a clinical engineer to help a mission hospital down there. And, you know, I had an aha moment. I saw that thing that we did for us here in the U.S. in our hospitals every day, and what you do around the world, it was very powerful, this hospital was building a new wing. They had equipment they wanted to, new equipment to buy, to keep or throw away. And I just saw that health technology, medical device management was a powerful force for good or for waste. And that really changed my life 30 years ago. Antonio?
And from my side, at the same time, Tom mentioned I was in my country, Colombia, in my beginning, and I was organizing for the Ministry of Health the National Engineering and Maintenance Center that then evolved in another institution just for provide maintenance and training to some engineers and some technicians, but I detect that the need was great, not only for my country, but for the initially countries of the Andean group, then joined PAHO. Finally, I went to Washington as a regional advisor, and my dream was to make the difference. And I has worked and continue working on that, and PAHO was a facilitator for this change, but we want to bring this message to all of you that if you dream in something, you really could get it.
Thank you, Antonio. So what can today's emerging leaders accomplish? And one of the ways we framed it in the invitation was many of us have had a chance to have some success in our clinical engineering careers. The question today is, can you find significance? So next slide, please. And I'm not implying that doing our clinical engineering jobs alone is not significant. It is, we know that. But can you check into a wider situation as well? So some of the key messages, this session will explore the global advances and gaps in terms of equity around health technology, and 4 other A words that Antonio is going to talk about in a moment. And this is based on data from 2016 and really for the 30 years before. And because there are gaps, we do need a global approach. So first, we're going to understand global health by way of Antonio and look into how to embrace global health initiatives. I'll just say a word and then Antonio pick up. There is, we're happy to report to you there is a strong global movement for clinical engineering health technology management around the world, and particularly the last 5 to 7 years. Antonio?
Definitely, as I mentioned before, health scenario is changing, is going globally, so we need to understand and embrace, because we have a strong responsibility, because important things are happening that are affecting our work, and also our work could influence and provide guidance and steering all these changes. Each day there are more interaction, communication, and information exchange with our clinical engineer colleagues around the world, and we need to reinforce this connection to move as a group in improving health and equity access of health to the population worldwide. Tom?
Thank you, Antonio. Just a couple words. I understand the VA is having a little bit of trouble hearing me. I've turned things up. I hope this helps. So what you've seen is a few years ago, Antonio and I and others were looking into connections around the world, and we saw about 50. And you'll see that in some of our data. And now, in 2017, we do see connections with 100 countries. We want your help, though, in doubling those connections to at least 200 over the next 5 years. One of the highlights of 2016 was this Global Clinical Engineering Day facilitated by Yadin David in the IFMDE Clinical Engineering Division, where there were 70,000 social media contributions on that day. We think that's pretty significant, heading in the right direction. Antonio's already said this, but the connection with the World Health Organization is huge in this global progress. We have a link at the bottom of this page, and on the link page to the WHO 2007 Health Technologies Resolution. Please look at that so that you see 10 years ago, WHO said, let's get going, and here's the platform we can build from. So today, we know we can make it better for our profession and for the hurting world that we live in. And we're going to begin to suggest some ideas of how you can get involved if you're not already. And certainly ACCE's International Committee led by Antonio and IFMB CE Division, of which I'm the secretary and on the board, we're happy to help you get connected. Next slide.
Now we will be talking about global health and how it goes with health technology. Global health is the health of the population in the global context. And the objectives of global health initiatives are improve health and achieving equity in health for all people worldwide. And we need to be organized in order to better detect and respond and control disease outbreak, epidemics, and pandemics, because it's very clear that disease don't know borders. They could be everywhere in a moment. And the term of health technology that Tom we will refer further, it refers to the application of organized knowledge and skills in forms of devices, medicine, vaccine, procedures, and systems developed to solve a health problem and improve quality of life. It's important, and this is the definition of WHO, that how health technology role in the health and in health services, and we have a taxonomy where we have health technology in healthcare facilities where we provide service to each person individually. We are more familiar with all those clinical technologies and support technologies in hospitals that they have been coming together through information technology and communication with healthcare technologies to provide telemedicine service and also to provide information to the clinical information system. But there is a branch that we as a clinical engineer have few contact or nothing at all, as in the public health arena where we provide service to the communities. We need to be more active because it's where the scenario is growing. We have technologies for prevention of disease. We have technologies for protection of the population, like vaccines. And also we have technologies for promotion of health, like education or campaigns of different type of disease. All these produce also a lot of information that goes into the epidemiological information systems, and in the largest scope is where the telehealth services are provided, because they go beyond that provide clinical service. But also there is a new field that is health technology in the personal environment. That is an extension of this public health going into the specific person. Each day we are more responsible of managing our health and our well-being, and there is devices that are now commonly used either at home or personally, and also produce personal information in health that goes to the large group of information system. Last but not least comes a new area that is health technology for genome that produce information. We need to get involved in there because this goes into the field of precision medicine. And all this is linked to the electronic health records. And here, the health technology manager need to be as a clinical engineer making the bridge with the information technology. We will be talking more about this. Next slide.
Thank you, Antonio. Next slide. So some references here from the World Health Organization and from the USA Institute of Medicine. These are, I think, folks on the line today are very familiar with these terms, electronic medical record, electronic health record, and how they can improve diagnosis and treatment. With health IT is the wider set of tools, including EHRs and EMRs, but we know they can improve so much care and treatment and diagnosis, but they have to be done wisely because of risks and downsides related to their use. Finally, WHO terms around e-health and ICT. Want to make sure you're just familiar with these terms. In the global context, e-health, the use of ICT for health, and this is WHO uses this around the world. Similarly to the 2007 Health Technologies document that was the platform for the growth of health technology management around the world by WHO, there was a 2005 World Health Assembly resolution. The World Health Assembly is WHO's annual meeting in Geneva where they bring all the ministers to health of their member countries together, and they had this resolution about e-health as far back as 2005. Next slide, please. So here we want to talk briefly, it's still setting context for global health technologies equity, talk about a divided world. Now, there's some countries named on this slide. We certainly don't want to embarrass countries that are maybe online today, and hope you don't feel pigeonholed inappropriately. This is data from the World Bank and from PAHO. It's pretty up to date, meaning 2015 to 2017. So stick with us on these buckets, so to speak. Developed countries, we all understand that, and I've put them in 4 regions of WHO. WHO has regions in all the areas of the world. Then the fast becoming developed, and then largely still undeveloped. I mean, I think this all makes sense. In the appendix, Antonio has listed some more attributes of development, fast becoming developed, and largely still undeveloped. For example, developed countries are technology producers, typically. Fast becoming undeveloped are developed, are technology receivers from around the world, and largely undeveloped or often receive donations. But there's several other attributes you can look back in the appendix. But so how did we get some of these names other than pulling it off the web and these buckets that we're talking about? Well, PAHO, Pan American Health, which is WHO Office for the Americas, typically thought of as Latin America and the Caribbean, although the U.S. and Canada are in there, list these buckets through the lens of the GDP per capita income in the U.S. for developed above 11,000 per capita GDP. For middle income, 3 to 11,000 U.S. dollars per year, and under 3,000 GDP per capita from a U.S. reference point would be largely still undeveloped. And you can see some of the countries they put into these various buckets from the PAHO work. So we just want you to think about the world through that lens. Next slide.
When we talk about health technology and looking what Tom was saying about these 3 segments of countries, what I will say now is applicable to all of the countries. Of course, the emphasis is in the not developed or underdeveloped countries and the fast developing countries. And you could extrapolate to your specific situation. But in any country, we have what we call an unfinished agenda in health. That means that although there are treatments and procedures to eradicate or deal with a specific disease, so far for all these 4A situation, we could not deal with that. Also, we need to be prepared to deal with new emerging or re-emerging disease. We need to be prepared, and again, we need as a clinical engineer to have this concept very clear. And first, I will address availability. That is an issue, because when a technology is available, it means you could obtain that for the specific purpose. You could buy that one, you could use it, provided you have the resources. It means a technology that can be accessed or used for a specific treatment, but unfortunately, large part of population could not afford, or even countries. Then you have affordability. Is when you could not meet the cost of the technology. So although it's available, you could do nothing and you don't have access to that. And that is jumping to the next concept of accessibility. You have it or not have it, but if you have it, sometimes you could not use it. You don't have the resources to make accessible to the population during the life cycle of the technology. And last is acceptability. And acceptability have two concepts for us. One is that the technology and specifically the devices meet the level of safety and quality to be used. But the other one is more difficult, is when the social or cultural situation in a specific country or region do not allow to be used these technologies on the population. So when we are planning our support or to decide what technologies to be used, mostly in many countries of the region, we need to have all these criteria in addition to our technical information and knowledge that we put in the selection of technologies. Next slide, please.
Antonio, I'll let you catch your breath.
Yeah.
So in the global HTM status, so we've set the stage with the 4As, with the divided world, with some different other things we said. ACCE has long been involved in the global clinical engineering health technology management space with our advanced clinical engineering workshops, otherwise known as ACEWs, and now many of you know Antonio has directed many of those, over 50 of these workshops now in greater than 90 countries since '91, and about 100 of our ACCE members have been faculty. So we allegedly know something. What are some things we might know? And Antonio, you pick up. It's not about building better hospitals. This is the old way, right?
Exactly. We need to get more involved that reader still working in health technology management, but we need to think in global health technology in order to bring equity. It's about building digital healthcare facilities, as Tom named, using our clinical engineering and information technologies skills, so we could reach all those underserved or rural dispersed populations that are all over the world, and they deserve to have health service with quality. Then we can save money and continue to saving life, meeting the 4 A's on health technology. Keep always that present. Next slide.
I agree. Not next slide yet.
Yeah.
We want to emphasize the balance between HTM, perhaps traditional clinical engineering, and CE-IT as we move forward. I know, and you know, that health technology management will be, as we've defined it, and we're going to look at a picture of it here in a moment, is very important for delivering effective and efficient care, particularly at the primary, secondary, and tertiary level, because evidence-based devices are needed as part of evidence-based protocols. I think of a situation I'm involved with and others, Ishmael Cordero's on the line here, working in Haiti, and particularly part of a project working on maternal child health. And, you know, WHO has clinical guidelines that has evidence-based devices built into them, you know, to get the best mother and baby outcomes. HTM is going to be very important in those kind of healthcare delivery situations. So I agree with you, Antonio. Next slide.
Now, when we go to global health technology management status, we have this graphic, and when we are talking about health policy, there is an area that clinical engineer played a role in health technology management, and you see the process that you are very well familiar with: strategic planning, acquisition, installation, clinical use, maintenance management, retirement of the equipment, and final disposal and feedback. That is the core, and this is our area. Sometimes we lead, sometimes we are part of the team, but there are other actors that are very important when it comes to health policy, and Tom will say what relation we should have with those groups.
And I'm going to really go on with the data on the next slide, but yeah, just keeping in mind we've shortened some of these long terms, HTP, MA, R, and human resource development. But if you want HTM, as the center of the slide shows, you've got to play well with all these other important partners. Next slide, Joseph. So take it away, Antonio.
And when go to global health technology management status, and this is based in data from 50 countries, but it could be also bring all our knowledge through the years, and we have strong gaps. And one of the main one is the lack of competent staff, lack of staff champions, leaders. We need to reinforce human resources development and help to continue growing the professional societies, country and globally. Also, there is still a limited access to technical documentation and spare part of the problem of health technology management. But also we have poor planning and lack of commitment of the decision making. We need to reinforce our management and planning capacities and get more policy in place to help these programs. Still today, there are irrational health technology incorporation and deployment, and there is a lot of unused devices all over the hospitals, all over the world. And the influence start growing, but it still is limited with the decision maker. When we start all these campaigns globally in 2011, we detect that less than 10 countries had health technology units in the Ministry of Health organization. And still donation is an issue that we could have a seminar just on donations, Tom, but we are almost there.
Yep. I hear that my voice is not loud enough, so I'll work on that. So as you see, these gaps that Antonio just spoke about were from a 2011 study looking back at the previous 30 years. We're happy to report that 5 years later, we have the advances that you see here. And just reminding you about these references, Ryan et al. Did this study in 2011 that Antonio and I participated in. There was a second global forum for WHO led by Adriana Velazquez, our colleague, in 2013, and then a paper after the Denver-Toronto ACEW in 2015, where we had a bunch of other colleagues join us. So we saw these advances of HTM training now is in 80% of the countries in the various regions of the world. Health technologies, professional societies at the national or above national, regional level have been created 40% around the world. Health technology policy developed at least half the time, if not more. And we saw a growth in Ministry of Health, health technology units doubling by 2015. So we've seen some advances. Next slide. I'm going to talk briefly about a project in 2016 led by the IFMBE, and you can look up what all that stands for, but it's the Clinical Engineering Division. It's the Global CE Society, a strong partner with ACCE and many of your societies around the world. And we had a challenge to go out and find the health technology or clinical engineering success stories around the world, and we found them in 6 categories: innovation, improved access, health systems, health technology management, safety and quality, and e-technology. Now you've got the definitions here. I'm not going to get over them, but we'll see some examples here on the next slide. Please download this white paper. This white paper called Health Technology Resource. It's subtitle Global Clinical Engineering Summit Success Stories. This was an important event that we did last year. We got success stories, and you see a copy of one of the key pages in that resource. This went to the ministers of health of 200 countries at WHO's meeting last May. So we're beginning to get the word out about the good that we're doing around the world. Next slide. And here's a range of examples in those categories. Certainly not going to touch on all of those, but there was over 150 stories from over 90 countries. And actually, that sounds good, and it is. The data collection, though, continues. We need your help in sending in stories. If there's 150 now, we'd love the next 16, 18 months to have 500. So tell us your stories. Send them in. But some of the categories here, around the world, think about innovation around the world. How can robotic surgery be best used? I think that came from Italy. Hospital design from Uruguay. How clinical engineers are making a difference in these areas. Device design for low-resource countries. That's a WHO program. Improved access. Our friends from Albania made sure that all the high-tech equipment that her country was investing in was up through wise service contracting with the vendors, and really improved access in a significant way. India involved with, as other countries have been, with mobile medical, improving access, very device-oriented. And then telemedicine for chronic disease, for diabetes, big deal. And you don't want me to necessarily go over all of these, but you see in HTM, talking about certification, training, and specialized equipment support. Health systems, pretty well focused on clinical engineering advances at the Ministry of Health level. E-technology, CE-IT, Tracy Roush working in India using integrated clinical environment data. Evidence-based medicine and maternal child health enabled by CE-IT in Haiti. Regional integrated health enterprise spread, Colombia and other places in Latin America, for example. So, and then safety and quality. So these are, you're doing things like this, we're doing things like this. We want you to tell us these stories that will help our recognition and growth around the world. Next slide.
As we mentioned, there is a shifting in global health paradigm. And in health at all now, we are moving from episodic health care to a continuum of health care. We are now not just going to the facility or the doctor when we feel sick, but we are more responsible of our health. It means this shifting is in patient-centered services, is oriented to public health, and the idea is that the care start before birth and end after death. And the dream of the planners, more than 30 years plus from Alma Ata, is that there is this continuum of healthcare, and information technology and communication and health technologies are facilitators of this process, and is also based on personal health management. We will be more responsible of our health, and the clinical engineer has a larger scenario where to work. But this is also a responsibility of the institutions, of the community, and the personal responsibility, and is based on education and lifestyle. All these bring global health and health technology a lot of threats and opportunities. But just to say that there is health technology and engineering solution that could be fine to support all these changes. It's our responsibility to find them and to implement it. So a lot of this solution with your creativity, with the health, could be done. Next slide.
Thank you, Antonio. So I'm going to briefly talk about a couple ends of the world and how they're combining CE-IT into their involvement. So one is U.S., one is China. I just come from 25 years in Kaiser Permanente, and how does their electronic health record, how do their health IT tools drive better outcomes? And I think what's, of course, it's interesting to me because I did the slide, but what's interesting maybe for you is that this is a combination of e-health and CE-IT, and it's not just medical device integration, what we talk about, which is a very important part of CE-IT and a very important contribution to healthcare in the U.S. and around the world. But CE-IT encompasses all of these areas. All of these areas are very device and technology, as we know it, health technology driven. So in the U.S., there's the government electronic health record meaningful use requirements. Suffice it to say, how do you use the EHR and devices to improve clinical outcomes progressively? There's the EHR's computerized physician practitioner order entry, where you get all these guidelines for care embedded into an EHR, and best practice alerts and alarms drive evidence-based care. Social media interfaces driving patient engagement. All of these are CE-IT things that we all need to be involved in. Interactive patient care at the point of care, both point of care testing and measurement devices, the data mining of medical device information for clinical decision support, otherwise known as CDS, the aforementioned medical device integration, mobile device applications for chronic disease management. We touched on diabetes earlier. Real-time location for clinical workflows and wireless setups that we all know about, as Antonio talked about, genomic patient evaluation, and facilitating improved telehealth for access and e-consult using mobile medical devices. These were things that we did in Kaiser and are doing in Kaiser Permanente that other health systems are beginning to do as well. Next slide. So on the other side of the world, if you will, e-health and CE-IT in China, also a big driver. You don't want me to go over all of this, but the challenges are the same: cost, access, quality, chronic disease management, infectious disease prevention. EHR and health IT are the tools being used. The current healthcare situation in that country in 2016, not unlike my country and the other countries around the world, as you see on the right, with resources are not evenly distributed. That's the global health technology equity we're talking about. How a lot of the public health systems Antonio's been talking about around the world come through the ministries of health, and there's emerging private systems, but costs are out of control, and we've got to use health IT and CE-IT to make a difference. And it's a big pillar in the reform of health systems in the countries, both for urban and rural areas. We need your help to make a difference in those areas. Next slide. I did a little study in preparation for this. What's happened since that big WHO resolution about e-health in 2005, and how big is, let's say, how is e-health global status, how is CE-IT making a difference around the world? And the issues at the top half of the slide are, what are the healthcare needs that need to be addressed, like we just looked at in the previous two slides, and how is e-health or CE-IT as an enabler of e-health making a difference? You see the countries and the references you can look up are China, Australia, Europe, EU, further global e-health, where it picked up several regions of the world, and then Latin America and the Caribbean. I think you get the story of this slide, and that is, you need government support. We're having aging populations with increasing chronic disease. Access is a problem between the cities and the country. Port quality is an issue in our care delivery. You need to have mobile platforms and infrastructure to support it. You got to have enough IT folks and CE-IT folks, including us, to enable it. Affordability is an issue and security is an issue. And e-health, CE-IT enabled, is making a difference all over the world in those issues. Next slide.
And so far we have some key messages. We have in this session explored current advances and gaps in our clinical engineering vision of equity. But because there are gaps, we need to have a global approach to better deal with these issues. And first, we need to understand and embrace global health initiative. We need to go a little deep. But yes, there is a strong global movement of clinical engineering and health technology management, particularly in the last 5 to 7 years. And Tom, you have been the leader, to say the least, of this, so give us some comments.
Well, my comments, let's move on. I think we've dive deep into this area already.
Yeah. So the important point is that we need all of you helping on this to bring in this concept development to the next level. Next slide.
Lots of pretty faces here. Hope you see yourself that are on this call. Go ahead.
This is a beautiful summary of the emerging clinical engineering leaders. This was 2 years back in our activities in Denver and in Toronto. That is the group that is leading. But we are at this point on time looking for the millennials, next generation, for passing the torch. So in the right side, you have the millennials of 2017, Tom.
Yeah, we don't want to say ACCE has cornered the market on CE-HTM growth and emerging leaders around the world. Certainly the folks from 32 folks from 20 countries that joined us in Denver and Toronto in 2015 are a great example of emerging leaders, but there's many more of you out there, and we're thankful for that. There's a few of us gray heads out there that are happy to be a part of that. But as Antonio said, this is an example of the new clinical engineering millennials, and this is, of course, Frank Painter's University of Connecticut Master's in Clinical Engineering with an internship program. And this, I think many of you know, represents master's students, clinical engineers that are making a difference in half of the last bunch of years. And this is the new crop, 22 of them, but they're from all around the world themselves. And there's other places where folks can get educated, but certainly Frank's has been one of the incredible programs. So we're just thankful about the emerging millennials and your friends, and we want you to lead the effort to make a difference. Next slide.
So now comes the point what we can do, basically what millennials can do, and one of the things is to share stories, share our passion. First, we recommend to be connected daily with our colleagues around the world. Many things are happening. Colombian clinical engineering is expanding fast, and they are creating nodes, and they are trying to interconnect the country of clinical engineering in a strong society. There are clinical engineering and health technology management topics and idea is very, very good all over the world. Be as communicated as possible, avoiding to have hierarchies. Sometimes the millennials that are digital-oriented mind know how to do it, and they do it pretty good. Tom?
So, Antonio, you were, and Mario Castaneda and others were in Medellin last month, and Andrea and others led that millennial CEs there, and a lot of women CE leaders, which is incredibly cool, like there are around the world. Tell us about these nodes, though, that Andrea and her friends started. Say a little bit more about them. What did they start doing?
What they do, they got 7 of the main cities where most of the large hospitals are located with clinical engineers in there. All those hospitals are providing the basis for locally strong clinical engineering group that are getting the surrounded clinical engineers, and they have now a structure with under the leadership of the Ministry of Health. They are meeting regularly, and one of those nodes is coming on a strong part, linking with the academia, with universities. And our experience in Medellin was that 6 universities with biomedical engineering programs are now oriented to clinical engineering. They have had the 3rd clinical engineering conference, and now they are looking to organize Clinical Engineering Association in Colombia. You will have some information.
I was just going to say, these nodes mean many different things at different levels. I'm going to interrupt Antonio and quickly say, when I was have been working with ACCE for a long time in an advocacy role. And, you know, it was always a dream for many of us that how do we get connected with each other, you know, daily, weekly, however often we can take it, but because we have questions, we're working on hard issues we want to share with our colleagues, and, you know, we don't want to necessarily have to go through our boss and their boss to have these conversations. You know, in the modern day, through social media, you know, the WeChats and the WhatsApps and the various other Facebooks and so on, Twitter, we can be connected to our colleagues without barriers, without bureaucratic stuff getting in the way, and we can just ask questions and get answers, and then we can form in little groups. So I just love what the millennials in Colombia have done. I think it's a great model for the rest of the world. We need to go on and connect and help each other in a variety of ways.
Exactly. They are working in a model like Uber for transportation, have a Uber for clinical engineers. That is basically the concept.
And so, of course, you know, there's slightly more formal ways to get involved and share what millennials and other emerging leaders can do via social media. You know, ACCE's got its collection of ways to connect via Antonio and through ACCE, Facebook, and so on like that. IFMD's got similar, you know, our website and our Twitter and our projects and so on. WHO's got its listserv. Many of us are familiar, of course, with Infratech. Maybe next slide, Jennifer, because I know we want to get to the questions time. ACCE has its blog that we need to use more. CED has its success stories you've heard me talk about, and there's a new journal that's going to come out, Judd David leading that effort. And of course, you know, present at global events. But Antonio, a comment from you.
Mm-hmm. No, definitely what we need is to contribute with articles. We need to write what we are doing in order to spread the knowledge. So, as I say, is plenty of we have plenty of opportunities, but the point is to make the decision to start to do it, join or create nodes, or choose countries or regions where you want to help or join undergoing projects. I mean, there are plenty of ideas, and you mentioned that there are organizations like ACCE, IFMB, CED, World Health Organization, even the Pan American Health Organization. They are very involved in this, so opportunities are there. We need all of you.
I will make a comment about there was a first World Congress for Clinical Engineers, and that started the Global CE Day work led by Judd David. There's a second one, and many of us gathered for that in 2015 over in Hangzhou, China. There's a second event, and it's not too late to be involved, coming up in Sao Paulo this fall in September. The abstracts now will be still, there's a few more weeks to the end of May to get them in. Let me tell you something interesting about the second Global Forum in Sao Paulo. We want you there. We want you sharing your best practices. There's a pre-conference day where exciting news breaking this week. Antonio and Mario Castaneda and Murilo Canto from Ajo, Brazil, who's a certified clinical engineer and a good colleague of ours. He was at the Denver-Toronto workshop, for example, representing Brazil. But Ministry of Health Brazil is sponsoring 40 Brazilians to come to this pre-conference day and then the Congress afterwards, as well as 10 global Latin American and Caribbean leaders. And CED will sponsor another 20 at least Latin American and Caribbean leaders for that regional summit event. So we need you involved in that in the Congress. Mario and Antonio believe there may be 100 people at that pre-conference day for Latin America, sort of getting our, getting on the same page and helping one another across a whole region. So very exciting news. Wish you could join us for that. The summary of this, what millennials can do, is join or start a node like Andrea did in Colombia. Maybe you want to choose a country or a region you want to come alongside just because you're interested. Join a project, start a new one. When you mentor and you come alongside, let's say, Jatinder in India, who's 36 years old, and he's leading a lot of clinical engineering and health technology management in India. Maybe your age, maybe so one of the guys out there like women can come alongside women. Maybe you would choose a colleague from your part of the world and come alongside Jitender and maybe one of his colleagues, Mohammed, maybe Emil there. My point is, it's not hard, it's relationships. Choose something you're interested in and do it. And we'd love to have you involved. Next slide.
And we have here some conclusion. The first and probably more relevant is health technology is a key for global health initiatives. And that is our responsibility. What we do, we will be responsible. What we don't do, we will be also responsible. And if we don't do it, somebody will do it for us. But there is plenty of room for innovation and collaboration. So get committed to this. And clinical engineers should be more involved in global health initiatives, and those are everywhere, or we could create initiatives. And another of the conclusion is healthcare services are moving out of the hospital walls. Back in Alma Ata during the 70s was that we need to go as a health staff to the communities. Well, we will see more integration and interoperability technologies, and that will be outside of the hospital. Tom mentioned e-health, telehealth, telemedicine. And also, it's challenging because we will see more complex systems of systems. And I strongly recommend reading all the Elliott Sloan papers in this area. Those are fascinating and is the future. And Tom, what happened with the deployment and operation?
Well, we know that it can do the things that you show here, reduce medical errors, make things efficiency, improve quality, improve cost effectiveness. But it also brings risks. So, and I think they're there. I think we're at a point where we want to do some audience response. But let's maybe next slide. I know you want to wrap up with one of your cool things here.
Oh, definitely. That is the secret garden. At the beginning, first, people refused to believe that a strange new thing could be done. Then they began to hope that it can be done. Then they see it can be done. At the end, when it is done, all the world wonders why it wasn't done that way for centuries. So that is our challenge, and I think that is one of the slides. Next one is Jennifer. We are in your hands.
So it looks like we have about 5, 6, 7 minutes or so for questions. So if anyone has questions from your group, if you want to write them in the Q&A or the chat box. Right now it doesn't look like we have any, so we can give everyone a minute or so to get your questions in, and then I will go ahead and field them to Tom and Antonio.
And I know they can write it in their box to George for Kaiser's, and he can push them over. Maybe you go to the next slide. It's a cool-looking slide. Jennifer.
Oh, we are multilingual, but Tom, perhaps
not so much.
Yeah, we could move to some of the appendix, some comments, rapid comments while the questions come. Go before the reference, Tom.
Well, it's just that there's a bunch of them here, and there was one that was broken that we sent out, Elise sent out just before. So I think you will find these helpful. Maybe next slide.
Yeah, but and then it.
Go ahead.
Yeah, no, I say that I recommend to check in all these reference because it's what we have said today is there in more detail. You will get more information, but then it comes to the appendix, and here you see some of the characteristics of this divide world in the 3 segments, and some of the issues that are heavy in some of those, but also all these issues you will find in every country, no matter how developed or developing is next, probably.
Antonio, there's a good question.
Yes, we actually have one question. So from the VA side, Dr. Lemgruber is looking to engage HTM. So how do you think that people can get involved in a meaningful way?
When it comes to the Pan American Health Organization that through the years has been leading this process worldwide, PAHO is an organization in the region of the Americas that has offices in most of the countries, and they have deployed teams there dealing with a specific health initiative or health issues and health technology, and at all is a large group where Alexander is responsible. So he is in permanent contact with the health authorities that are providing some information of a specific request. So from that part, we could get exactly information what is needed, but also through Alexander we could feed the information of what we are doing and how we can help. Exactly is what we are doing right now with Tom, with Mario, with Jadine in organizing this conference in Sao Paulo, September 21st. It will be for Latin American and Caribbean countries. And Alexander, with Murilo Conto, that is the official engineer in a PAHO office in Brazil, are the one organizing, are inviting the governments to send delegates to this activity.
Antonio, I know we're going to run a little short on time here, but so VA is asking, how can, come alongside what PAHO is doing, because Alexander Lemgruber is the PAHO health technology leader, and they're doing a lot. And so I think we'll have to deal with those questions personally between Antonio and I offline. Yeah. We'd love to talk about that more, but he is, as you heard, facilitating this work on Wednesday, September 20th, before the Thursday, Friday, Saturday Global Congress. And the gringos and gringos can help our Latin America work, so we can find a way to do that. He is going to facilitate a 2018 event for all of Latin America, mediated through PAHO. So that's some very cool stuff. There was another question, Michael Ching on the other line. CE is still imperative. Do we have an impactful message? We believe, Clinical Engineering Division of IPMBE believes the white paper, the Global Success Story paper, has those messages around getting greater recognition globally with ministers of health, getting the right educational programs not only at the beginning of our careers but throughout our careers. We're carrying those very important messages to the ministers of health and through WHO. So I think that's our main document. There was another question, are there joint initiatives to coordinate CE-HTM global initiatives with other healthcare providers like Doctors Without Borders? CED is working hard globally on that, and bringing ACCE, involvement into that, because ACCE is what, 25% international, and Americans from the Caucasians, so to speak, or whatever from North America, African Americans are very much a part of global initiatives. So, but the short answer is CED is mediating that. Digital healthcare facilities, I'm talking CEIT. How do we build CEIT as well as HTM into facilities both in the U.S. and around the world? That's what we think. Antonio, your comments?
Well, we will address this on detail, but coming back, for example, to BA was one of the strong supporters during my tenure at PAHO. I mean, in every front, from education to information exchange, BA was one of the best collaborators we had. So we will be following on all these questions, and we are inviting all of you to write to us with your ideas in order to move forward or organize new projects.
And Jennifer D., I know you need to bring us to a close. I see Jennifer D. asking the question, do I see HTM and IT combining in the future? I mean, where I come from in Kaiser Permanente, they were combined. It was, one was the history and one was the future, and they are combined now. So I know ACCE and CED are very involved in CE-IT training as part of initial and ongoing training. So I think they will be part and parcel, but back to you, Jennifer.
Yes, and so I think that this brings us to the end of our hour today, and I'll swing back to Tom and Antonio's thank you slide. Thank you, everyone, for joining us today. Tom, Antonio, do y'all have any closing words?
We look forward to hearing from you guys and working with you guys. Thanks, guys and gals.
And we are here to help and also to get your help to help others. We always think in the population of the world, especially that with limitation to access to the health services. And I want to thank you for attending this workshop, and thank you, Tom, for sharing with me this information. And thank you, Jennifer, for leading this process.
And Jennifer, I make one last comment. WHO's third Global Forum for Medical Devices is a month from now in Geneva. Several of us will be there, so it's an opportunity to work together with global colleagues. So go on and volunteer now so we can plug you in. Thank you very much.
Thank you, everyone. So we'll wrap up today's call and have a great Thursday.
Thanks.
Thanks.